Love can be exhilarating and wonderful, but it can also be painful and complicated. Join clinical psychologist and best-selling author Dr. David Hawkins as he reveals the truth about the good, the bad, and the ugly aspects of relationships. Listen in as he gives you practical tips for hope and healing. Welcome to the podcast, Mad in Love.
Hey, hello, listeners. Welcome to another podcast of Mad in Love. Yeah, I'm Dr. David Hawkins, and I am really excited today. We're going to tackle a difficult topic. We always tackle difficult topics when we talk about narcissism and emotional abuse, and it's just really a complex issue. And so I'm so thrilled that I have gathered around me. I'm in a very privileged position. I have colleagues that have as much experience as I do, and I've been around the block a few times. But with me today, I've got somebody who's going to help me unpack. Actually, he's going to do most of the unpacking. I'm along for the ride. The topic is going to be male chauvinism and NPD, narcissistic personality disorder. And it's a complicated topic. It's really complicated, but it is so prevalent. And I'm glad that we're going to unpack it. So with me today, my esteemed colleague, Dr. John Hudson. He is with us at the Marriage Recovery Center. And Dr. Hudson, I want to just give you a warm-hearted welcome, and let's jump into the water. I'm happy to have you here.
Thank you very much, Dr. Hawkins. It's always a pleasure to have a conversation with you. I enjoy talking about what we're doing, and it is such a relevant work. It has been for some time, but I'm so glad that we're able to really speak to this topic today, the differences between chauvinism and narcissism and how those are sometimes coupled together and confused. And this has come up quite often in my work with the guys in the core group that we do at the Marriage Recovery Center.
Let's begin for our listeners, Dr. Hudson. Let's begin by spelling out some of the differences and what do we even mean? I mean, we anybody who's been around and not under a rock has heard the topic male chauvinism, or even the pejorative phrase male chauvinist pig. And so I think we all would nod our heads and say, of course I know about this topic. But let's, if you would explain for listeners, what do we mean when we use the term chauvinism or male chauvinism, and how does that overlap with the topic of narcissism or NPD? So enlighten us about that, and I'm sure we're gonna have lots of questions, and it's going to be very helpful. Take it away.
Well, first of all, they're very different terms. Chauvinism has to do with a group of people, particularly men. The origin actually comes from France, and it was meant as a patriotic, an overly patriotic, or an individual who believed their country was much better than any other country. So that is a group of people, right? And so today, when you hear the term male chauvinist or male chauvinism, it's talking about men writ large, not an individual necessarily. So that's chauvinism. And you mentioned the term. It was
an esteemed notion at one time. You're saying
absolutely.
It was. Yeah. Somebody was proud. Yes, of course I'm a chauvinist. That's a good thing to be.
Right.
Is that what you're saying?
Yeah, originally it was. And as that term progressed through time, now it's more of a derogatory term in that men are better than women or girls. So it promotes a groupthink kind of idea that men should be held in high esteem and on a pedestal, whereas women are not, right? and very different from the term narcissism.
So chauvinism, can you speak to this? I'm assuming, Dr. Hudson, that chauvinism, as we talk about it today, it's embedded in our culture, correct? I mean, when you say groupthink, so I might be a chauvinist. I mean, I'm not wearing that label necessarily, but I mean, it might be, I mean, I grew up white Anglo-Saxon Protestant, so is it embedded in our American culture and our world culture?
Oh, I believe it is in some cases, some cultures to a lesser degree, but absolutely we've been, both, I think you and I were raised in that culture where men were the breadwinner. They worked outside the home. Women stayed at home.
Yes.
That was their place, right? And so it was really taught to us that way, right? And not in a healthy way now. We see it as a separation between men and women, which is not where we need to be. Not really where we ever should have been, but certainly where we don't need to be today.
You raise anymore, Dr. Hudson. I ask myself, do I have any racist qualities? Do I have any chauvinistic qualities? I'm at least asking myself those questions. So I was raised in a family where my mother stayed home, and that's how I was raised. My mother stayed home until I was 12 years old, and then she went out into the workplace. So you use the phrase breadwinner. My dad was the breadwinner, but even that term is, I don't want to go off on that tangent, but that's a little bit, that's a little crazy to say why did my mother, wasn't she a breadwinner too? And in raising 5 kids and keeping a home and volunteering at the church, and anyway, so on and so forth. But it's embedded in our culture and probably embedded in the way many of us think, this group think and male privilege and so on.
I absolutely agree.
Help us contrast.
Yeah. So contrasting the difference, right? I mean, can you have a healthy version of who stays at home and who's working outside the home? And I want to use those terms very carefully because they should be equal partners regardless of their role, right? And
great point.
And not to go off on too much of a tangent there, but as we learn from our faith, we're created as equals in God's eyes, and our spouse is to be a helpmeet or a helpmate, right? The difference where I think we cross the line where chauvinism becomes a problem is when you're no longer a helpmate, you're a helpmat. Somebody who's
I've never. Yeah. Oh, that's not funny. I've never heard that term before, Dr. Hudson.
Yeah, and that person then has a lesser role, and it really shouldn't be. I guarantee if I tried to convince my wife that she has a lesser role, she'd have some words for me about that. That would put me hopefully back in my place, right? So, yeah.
So contrast that now. How these terms, quite honestly, they confuse me a little bit. As I was preparing for this podcast, I do think there's a blurring of these topics. So male chauvinism. So you're saying, again, just repeating. So male chauvinism is a gender determination. It is men who believe that they are superior in some way. Mm-hmm. So how does that contrast from narcissism? Because it sure sounds like narcissism. Every man coming to the Marriage Recovery Center, every man that we're working with, Dr. Hudson, I would say has issues with superiority. We don't have to go off on that, but how do we tease these two concepts apart?
That is a real good question, Dr. Hawkins. And in my preparation for this podcast, I ran into where I came to this realization is that the chauvinist term like I said, is more of a group identity, right? Whereas a narcissist, it's all about him. Chauvinism is all about them, the group, versus narcissism being about him, the individual.
Is that the distinction then, Dr. Hudson, that chauvinism is a group? You know, I'm special because I'm a man, as opposed to the narcissist says I'm special just because of kind of who I am, because of my status, because of the amount of money I make, because of the kind of car I drive, because how bright I am, I got great grades in college or whatever it is. Is that the distinction then?
That's the distinction. I'll start again. That's the distinguishing mark that I see, that I've encountered, where men cross the line as a person, as an individual. They have specific traits, and we could talk about those if you want to for a few minutes, but it all rolls into this: who he identifies as a person and his personal demands versus his identity as a man, as a whole, as a group, right?
But then, so it seems obvious to me, tell me if I'm thinking about this right, it seems like there certainly could be a blurring. So the narcissist who thinks he is special or she is special, but you know that probably 90% of, at least the statistics that I've read, 90% of those that have some kind of diagnosable or on the spectrum of narcissism, 90% are men,
correct.
10% are women. So not that women can't be narcissists as well, but I'm imagining people listening are thinking, okay, wait a second now. You know, my husband thinks he's special because of his personhood, because of his privileges that he has at work, because of the money he makes, because of the car, because of whatever. Something about him is just a cut above. But if he's a man, then doesn't that blur the issues? So a lot of male chauvinists are narcissistic, and a lot of narcissists are chauvinistic. Am I getting this correct, or should we tease them apart?
Well, we can tease them apart a little bit, but they are absolutely, there's a blurring, there's a connection, right? It's sort of the, you know, when you used the term earlier, the derogatory phrase of a male chauvinist pig. And I would almost challenge that in this way, that possibly that guy truly is a narcissist. He's not a male chauvinist pig as much as he probably is a narcissist, because everybody, male and female, centers around him, serves him. Does that make sense? I mean, so it's not just an exclusive male-female thing. A narcissist is the center of everyone around them in their mind.
So if I'm hearing you right now, then you're challenging us to think even more critically, that the situation is even more. If a man were to say, "Yeah, I'm a chauvinist," no, you're not just a chauvinist. You're also narcissistic. You're also emotionally abusive.
Correct.
It is far more serious. You can maybe get away in our society with rolling your eyes and saying, "Yeah, I'm chauvinistic. Yeah, doggone it, I'm just a chauvinist."
Yeah.
No, are you saying that? Are you saying it's actually much more serious that if you are chauvinistic and you are narcissistic, you're a more dangerous individual?
I would absolutely agree with that. And it's interesting, you use the word dangerous, and it's not necessarily a physical safety thing. We talk about this a lot, of course, at the Marriage Recovery Center, because guys will say, "Well, I'm not a narcissist, I'm not abusive, I'm not and they get stuck in, "I've never hit her, I've never pushed her, I've never damaged her," right?
Right.
And they don't understand the difference between physical abuse and emotional abuse. They don't parse that out. They don't see that as abusive. "Well, I just yell a lot. I have a lot of demands. I have a lot of needs, right? That they say, which really are desires, but that's a separate conversation, right? But yes, I would absolutely agree that there's a threshold, I think, that sometimes merge the two, but then sometimes cross over into being a narcissist.
I want to comment a little bit more, Dr. Hudson, on the term dangerous. I had a man yesterday, and this is a story I could tell 1,000 times, but I'll tell it once. The man said this to me. He said, you know, my wife tells me that you wound me the first time by something that you do, say, did. But then when I bring it to your attention, you stab me. This is his words that she says. You stab me 5 more times by being defensive, argumentative, manipulative. And he used the word stab. So I just want to illustrate that point. You're hearing these stories as much as I am, that she really does feel stabbed, wounded, damaged, harmed. So again, all I want to do here is just highlight for people this notion. So chauvinism, I do want to circle back on that, actually, Dr. Hudson, because I do think chauvinism is a dangerous thing. Mm-hmm. But chauvinism combined with narcissism, self-centeredness, privilege, power, superiority, that is a really, really dangerous thing. Is that am I too far out on a limb, or is that all fair to say?
That's all very fair to say. And I think it's way too easy to progress into more dangerous territory. I have heard the story you just shared at least 100 times, where there's that progression, and he doesn't see where he crossed that line, but she feels where he's crossed that line. Right.
Yeah. And that's a great point to highlight, that narcissistic abuse and emotional abuse is often felt more than it is seen. So the man who slams a door and the man who throws a chair, or a man who slaps, mm-hmm. That's called overt abuse. We see it, we know it, no mistake about it. This is wrong, bad. But the man who uses sarcasm, the man who is defensive, who you can't penetrate his shell of protection. So when she goes to him and says, hey, I got my feelings hurt a few minutes ago, and he flips it back on her, he defends himself, he makes excuses, he attacks her for even bringing up something so insignificant. Boom, boom, stab, 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 stab. So anyway, that's called covert emotional abuse. I'm going to weave that into probably every podcast, but it certainly fits into this podcast. Would you say?
Absolutely. And there's great confusion out there, Dr. Hawkins, about this, because when an individual, period, is confronted with the idea of potentially having narcissistic traits or being a narcissist, they absolutely say, no, that's not me. And we know exactly what they're thinking. They're thinking about the overt narcissist. And we all know that guy too. That guy is very demonstrative in his attitude, his action, his words. And it's usually not limited to the home, which is a very distinct difference between overt narcissism versus covert narcissism, which is typically exhibited in the home or in a private place or behind closed doors, right? So that's the big difference there, the big shift, right? That is confusing a lot of people, right? Overt narcissism is not something the public sees. You've spoke about this a lot, Dr. Hawkins, where there's this difference between a Dr. Jekyll and a Mr. Hyde.
Yes. Yeah. So these are all great points. So back to the topic here. So chauvinism is a dangerous thing. How I want to just camp on that a little bit more. How might we see chauvinism, and how might we tease it apart? How would it show up? If you're listening, you do a lot of marriage assessments. You do a lot of evaluations of couples who come to the Marriage Recovery Center. What do you listen for that helps you say that that's chauvinism as opposed to that's narcissism? Or is it even sometimes impossible to tease it apart?
Oh, it is sometimes difficult to tease it apart. And thank you for that really good question, Dr. Hawkins, because what I experience in the conversations with men is that they say, well, this is just the way men are. This is what I was taught. This is the way my dad raised me. And look how successful I am. Look at where I am in life. Look how things are going for us. She shouldn't have anything to complain about. I give her everything she needs, right? And he is locked in that idea that as a breadwinner, as the man of the house, he has privilege because of that. Not just because he's the man, because that's what worked in his upbringing or appeared to work, right? But that's where he is. And society tells him that.
Can I stop you? That's so important right there. So there's an entitlement to this issue. He's the breadwinner. You used another phrase that I don't think we can use it anymore, Dr. Hudson, the term man of the house. It's okay that you used it, by the way. I mean, it's part of our culture, but he's the man of the house. That would be, well, I don't know. Is that chauvinism? Is that narcissism? Is that an attitude of superiority? He's the man of the house. But I was raised that way.
Yeah,
it's the way I was raised.
Yeah, but I think it's rooted in chauvinism, right?
Rooted in chauvinism. Because
shouldn't they, if husband and wife are together, shouldn't they be equal partners? Shouldn't they have equal say, right? And yeah. I mean, certainly you might have areas that you've negotiated as a couple where, the man makes a decision in this area, the woman makes a decision in this area, but we're not talking about big decisions. We're talking about day-to-day living. My wife is not going to tell me what I'm having for lunch necessarily. No, she might, but because she wants me to be healthy, right? But that's a different topic, right?
Right.
But we're taught
good catch there.
But we're taught that we should be able to make the decisions because the buck stops here. You remember that phrase?
Right.
Yeah.
Yeah. So it's embedded. All of this is embedded in our culture. And I think just so far from this podcast, one takeaway, I already told you that, Dr. Hudson, I just find myself, the more, the Me Too movement, all these different movements, they really kind of shake me up, to be honest with you. Like, was I, have I ever been covertly emotionally abusive with Christy? How did I raise my sons? Anyway, we don't have to answer those questions, but I would challenge everybody just so far in this podcast to just pause and ask themselves the question, where are you on this topic of male chauvinism? And is there any, so every man that comes, I've already said this, every man that comes to the Marriage Recovery Center, in my opinion, has some kind of an issue with superiority. So this topic of chauvinism, there's a superior gender.
Right.
I just hope everybody will pause. I hope everybody will pause and ask themselves, do they espouse, do they cling to, do they justify any kind of an attitude of superiority? So is that kind of one of our takeaways, is to ask ourselves the question, are we narcissistic? Are we chauvinistic? Are we abusive in any way? Is that one of our takeaways?
It should absolutely be one of our takeaways. And that requires some really in-depth self-reflection that is informed by the people closest to us. Self-reflection is important But to be objective, we need to be willing to have that 360 view that comes from the people closest to us, near us, to us. And who knows you better, most of the time anyway, but who knows you better than your spouse? What's her experience with you? Right?
I have all of the men that I'm working with, Dr. Hudson, ask themselves and ask their mates. And sometimes, we have a lot of men who come and work with us and women who work with us who have adult children. And I think your idea, here's another takeaway for everybody, doing a 360-degree review like they do in business. 360, baby. Let's really find out what she is thinking. Let's find out what our adult children are thinking, or maybe they're adolescent children. Anyway, let's find out what they're thinking and get a review. I want to shift a little bit back to the topic of danger. Why you haven't used the word misogyny? And I'm wondering, I don't want to just get too far afield, but should that word be woven into this conversation?
I suppose it can. It is an interesting term, but you have to know that the definition for that really is a complete dislike or hate for the opposite sex. And just as chauvinism can be both ways, by the way, we don't want to dismiss that, because there is such a thing as female chauvinism, but there is misogyny is a hate or dislike for the opposite sex, or and traditionally male-female roles, right? So, but traditionally that's male. Hating women or girls doesn't mean they don't want them around, but they dislike or hate them.
So I'm confident in all the evaluations that you do, all the couples that you're one of our main screening people at the Marriage Recovery Center. So you hear these stories as much as I do. So many women would raise their hand right now and say, I am hated. I am confident that I am hated. And I often will, like, I don't know, I just get a little uncomfortable when a woman uses that word, like, hate? Really? And she doubles down and says, Dr. Hawkins, I'm talking hate. I'm talking hate. We're not dislike, not, he's just a little resentful. I'm talking hate. So are you suggesting that we don't see misogyny? Are you suggesting we do see? How do we weave that into this topic of chauvinism and narcissism? And is that a real deal?
I believe it is. And the difference, again, if you couple it with chauvinism, it's more of an all-inclusive kind of mentality, right? So misogyny can exist at the basic person-to-person level, but it's traditionally all women, or all girls or all females, right, are a lesser being, right, or a lesser, of lesser value, right? Then you might see this in a family setting where the father takes care of his sons, but dismisses his daughters and their needs in the same way that he has dismissed his wife's position and her importance and role in the family. So what she's experienced as hate, and you use a term, and I hear that term as well, is years and years of this dislike or disdain or dismissal, which has, from her perception, turned to hate. He doesn't just not like me anymore by what he says and how he treats me. He must hate me because of the way he treats me.
I want to unpack this some more, Dr. Hudson. I'm finding it a little bit difficult to understand misogyny and chauvinism and narcissism, and I do hear that they all overlap a fair bit. On the topic of misogyny, so you and I hear this all the time. We hear a woman who says, I am, in fact, this is the way she will say it to me. You can believe me or not believe me, but I am convinced that underneath everything, there's just this deep-seated resentment, bitterness, superiority, and they use the word hate. So in your experience, are we seeing misogyny? Are we seeing a man who simply has no way? I don't want to let any man off the hook here by saying this, but is this a man who lacks any kind of assertiveness skills? And by that I mean the ability to share emotion and to share what his preferences are. No, it comes out in this. But I don't know. Is there? Are these the narcissistic men that we're working with? Is there misogyny underneath the surface, do you think, in a fair number of them?
I think there is. And you've written about this, Dr. Hawkins, where you've talked about their family of origin experience, these men who had not so healthy relationships with the female in their life, whether it was their mother, grandmother, older sister, whatever, which has turned into resentment, bitterness, now rage, when they experience those kinds of criticisms, which often are healthy, but criticisms or critiques from their spouse. And it comes out as, I'm not putting up with that. I don't have, that's not me. And you can't say that to me, et cetera, which is flatly rejecting, which is a well-meaning criticism from his spouse.
Does it also go, I don't want to get too far afield here, but does it also go into difficult relationships with fathers where they've had a dominating, impenetrable father who's just, kind of beaten the life out of this man, and maybe they were actually indulged by a mother? Do you see that dynamic at play as well at times, or no?
Yeah, absolutely. That can exist. And what I often see in that case, Dr. Hawkins, is where a man was raised a certain way, where he was challenged and, pull your, self up by your bootstraps and move on. There's no room for feelings here. Real men don't cry. All of those terms that we hear, that's what they were raised with. And they try to employ that same parenting model. You want to call it a parenting model, but that same model with their own sons. And they're now repeating that family cycle. So absolutely, that can exist as well.
So I'm thinking of several men who, many men, not several, like many, Dr. Hudson, who had a father who back to this notion of chauvinism and narcissism and misogyny. I just think there's a lot of men who right now are, maybe they're aged 40, 45, 55, 65, and they were raised in that baby boom era where the father was the breadwinner. He was the man of the house. He was the dominant figure, and he was told that's just the way you do things, and that's the way, son, that's what you got to do. You got to run your household. And so I just think we're trying to overcome a lot of really bad learning, and but it's embedded in our culture and needs to change, definitely.
Absolutely. And I might be dating myself a little bit, but if you remember this, there used to be a TV show called Father Knows Best.
Oh, my goodness.
Is that not?
You are dating yourself, but I remember it.
Yeah.
Father Knows Best.
Isn't that indicative of where the culture that we came out of, and that there was no other voice that mattered in the home other than the father's?
All right, let's shift gears a little bit and talk about, I just don't know that we can talk too much about NPD, narcissistic personality disorder. And how does that whole concept, enlighten us about NPD, narcissistic personality disorder, and how do we weave that into now? We've got the topic of chauvinism. We've got the topic of misogyny. We've got the topic of narcissism. How does NPD fit into this whole equation?
That's a really good question. And actually, Dr. Hawkins, I got this question in group the other day. I was meeting with a core group, and one of the gentlemen challenged me with this question. He said, when did this all start? When did this whole idea of narcissism begin? It seems like it's the buzzword today. It's the new fad in counseling. And he kept talking about psychologists and psychiatrists and this new term they're using, narcissism. And it wasn't me who had to answer that question. It was very interesting. One of the other guys in the group said, well, it's from the Old Testament.
So, been around for a while.
It's been around for a bit. And I would say prior to even, it's not a new term. It's just now we're realizing how dysfunctional it is and how we need to address it and how it changes, actually transforms a marriage and a family if you can address it the way we are.
Was not to focus too much on that particular man, but the way you presented it, Dr. Hudson, was the man sounds like he was very dismissive. Like, what? I mean, come on, this is a buzzword. We're making too much of this. I don't really know that I'm a narcissist. I don't know that this is really as big a deal as we're all making it out to. Was it that kind of a dismissive quality? Like, we're spending way too much time talking about all this frivolous stuff. Was it that kind of an attitude?
It was. In fact, he made a very, very, very interesting point. He said, we've been married for a very long time. So for 45 years, things have been fine until 6 months ago when she saw one of your YouTube videos. So he started to blame it on you, Dr. Hawkins. Yeah.
That is so, I do want to camp on this for a few moments, Dr. Hudson. Because I hear that story too. Like, our marriage was fine. We didn't have any problems. And then I saw a YouTube video, and I'm going to tell you the flip side of that story, Dr. Hudson. As you well know, the flip side of that story doesn't sound like that at all.
No.
Not a bit.
No.
Here's the flip side of the story. The flip side of the story is the woman who says to me, I have been in pain. I have been mistreated for years and years and years and years. I've been unhappy, but I buried it because we had kids' soccer. We had church to go to. There were jobs to do. There was a house to run. There were kids to raise. And so, no, I didn't watch YouTube videos back in 1994 and 2004 and 2000. No. But I was unhappy. And then, and I'm not patting myself on the back here, Dr. Hudson, to say this. And then I saw your YouTube video, and I watched it again and again and again. And then I watched other ones and other ones and other ones and other ones and other ones. And the light went on like, oh, there's a name to this stuff. So that man, back to your story, that man who said, oh, our relationship has just been fine. It was fine until she watched the video, and then the video gave her these ideas that are just a bunch of nonsense. My wife hasn't been in pain. So comment on that comment, the other side of the story from what we hear.
Yeah, I hear the opposite side of the story as well. As I walk through these, Dr. Hawkins, through these marriage evaluations, I hear her story. And maybe for the first time, he's beginning to understand that there's a problem because she's said, enough is enough. Either you change, we change, or we're done. And it's often at the point of separation, or maybe she's even considering filing for divorce because she just can't handle him anymore, because she's come to this realization that this is not healthy. This is not promoting a healthy relationship for both of us to enjoy. Yeah, he might be happy.
Yeah.
He might be pleased because he's getting everything he wants or everything he says he needs, whatever that looks like, right? But she has been hurting for years and has not understood that there was a problem. So, yes, maybe there is some new realization that's occurring, but it's not a new phenomenon.
And not to get ourselves out of the hot seat, Dr. Hudson, but we're not to blame.
No.
You know, I do new videos for one reason, maybe two reasons. One is because some idea occurs to me, like a woman will say something. A woman said to me not that long ago, yeah, he has this sense of superiority. And I thought, I've heard that 1,000 times. I'm going to do a video on that. I didn't come up with the idea. I don't have anything original. I'm just doing a video on, man, I've heard that before. I've heard that before. I've heard that before. So, and you're doing videos, you're hearing the same stories I'm hearing. So folks, don't anybody throw rocks at us. All we're doing, we're just holding up a sign saying, heard that before. Here's what I heard today. Here's what I heard. And it's echoing. There's an echoing that's going on. And so, yeah. So back to NPD, though. Tell us some more. How does NPD differentiate from chauvinism, narcissism, misogyny? I'm assuming they can all blur together, but if we were to try to differentiate, what would that look like?
Well, we'd start with the idea that beyond the basic differences in the definitions, narcissistic personality disorder is exactly that. It is a classified personality disorder. Distinguishing it from just a definition, just a term that we throw around, right? So there's been a lot of thought, a lot of research into the idea of what is narcissism. You know, the interesting thing about that is it's, and this has been my experience, and I think it's been yours as well, that sometimes we don't really classify a person as being a narcissist in the full, right, in the full spectrum, right? There's
NPD.
Right, NPD on that spectrum. They're not way over here. When I talk to guys about this, because they're usually very resistant, they don't like the term. I'm not an abuser, so don't talk to me about emotional abuse. And I'm not a narcissist. Don't call me a narcissist. They're offended by those terms. So my challenge to them when I meet them through the marriage evaluation and later in core is to talk to them about the different traits and to challenge them in those areas and say, these are classified traits of NPD. Do you identify with any of those areas in your life, in your marriage, in your family of origin, possibly? But have these existed around you and in you? And that's usually the best beginning of that conversation.
Share a little bit more for folks. I have long said, Dr. Hudson, that most of the men who come and work with us at the Marriage Recovery Center would not meet the criteria for NPD. I think there's 9 traits if we to be diagnosed with NPD. But you use the word personality disorder. Many of these issues are what we clinicians call characterological, meaning they're embedded in the character and thus make it more difficult to treat. Can you comment on that? Am I correct about that? That many of the men that you see when you do the evaluations and when you do your core group, which is just a wonderful thing, by the way, you do these groups for men to learn about emotional abuse. But do you find that the issues are typically embedded in the character as opposed to being, I guess the opposite would be superficial and easy to change? Are they, comment on that, the characterological nature of what we're working with, if you have NPD traits?
That's a really good discussion, Dr. Hawkins, because often what we see is there may be 4 or 5 of the traits that they can identify that, well, she certainly has said, I lack empathy. She certainly has said that I'm too defensive, that I consider myself to be greater than the next person all the time. I'm better than other people, and arrogant, right? Exactly, and sarcastic in the way they treat the people around them, especially people who challenge them in as far as what their role is and who they are, or they're actually better than them. Then they find a way to tear them down. That's part of that narcissistic personality disorder. I'm going to bring this person down to my level or lower so that I can feel better about who I am. So those are the kinds of avenues I take to have those conversations. Has she ever said this to you? Has she ever, said that, well, you don't have any empathy for me, but you seem to care for everybody outside of the home, at church, in your workplace? You know the clientele we have, doctors and surgeons and dentists and lawyers, and successful businessmen, who they're told by their peers, they're told by the people who they work with that they are all that, right? So when you get to the ground truth of NPD, though, there are those 9 traits, and we walk through that. When I talk to guys about this, it's interesting. What I'll do with them initially is walk through the 9 traits, and it's sort of a fluid. When we have a much formal diagnosis tool that we're working on, that's for another day to discuss. But the initial informal way I'll go through is I'll talk about the traits, describe them, define them, and I ask each of the guys, okay, right there in group. We talk through them. I said, now give yourself a score, 0 to 10. 0 meaning this is not me. It's just not who I am. 10 to being that's me all the time. So they do this assessment, objective self-assessment in group, and then I turn the table on them a little bit. I say, now, pretend for a second.
What would your wife say?
Exactly. And it's amazing the differences in the scores that we get. But that is the aha moment for many of them.
So, yeah, very good. I love the idea, Dr. Hudson, of have you ever heard or have you considered, would anybody else ever think that maybe you have an attitude of arrogance? Has anybody ever found you, has your wife found you to be defensive? But I want to go back to the question, Dr. Hudson, if you could say a little bit more about, I'll tell you why I'm asking the question. I think we live in a society that goes to the pharmacy and gets Band-Aids for cardiac arrhythmias. Mm-hmm. We're a fast. And so I had men in my advanced core group where men go through our core program with you. Then they toggle into my advanced core group, which you're doing those as well. But these men, they're proud of themselves. It's not funny. It's I don't know what it is. When a man is proud of himself that he's gone through 14 weeks of therapy, 14 weeks of group treatment, and I say to them, yeah, that's just a beginning. Right. It's a good beginning. It's a great beginning. But then we're going to want you to do the advanced core, and then we're going to want you to do core strength, and then we're probably going to ask you to do advanced core again. And sometimes their eyes widen and well, yeah, my wife would certainly applaud that. But I never thought, anyway, back to the question of how steep is the mountain that they need to climb? Are these characterological, my question, sorry, a little long-winded here. Are these characterological issues? Are they embedded in the character? And which I think they are, but you may disagree with me. And then I think we're also talking to the women. When I ask the women, how much change do you need and what efforts have you made? And often the efforts have been quite meager, partly due to his or largely due to his resistance. But are these characterological issues, would you say?
Yes, I absolutely agree with you, Dr. Hawkins, that they are, and that they are not easy to overcome. And I love the fact that you brought up the point that, you know, sometimes initial individual counseling before a man is ready for core, which we've talked about, you know, assessing individuals as to whether they're ready for a group atmosphere, right? But even core is simply the beginning groundwork. I tell them it's simply a foundation for improvement that you're going to work out for the rest of your life. And for some of them, it's a little bit eye-opening, but for others, it's like, what? I need to work on who I am for the rest of my life?
Yep.
Yes, you do. Absolutely, you do. Change is not something that occurs, barring some sort of miracle, overnight. It just does not happen that way. Change has to be, and I use the term glacial change. Glacial change is
glacial.
Change,
Okay.
right?
Okay.
So, and when I'm asking the women for feedback at the midpoint of core or at the end, I'm I do want honest, objective feedback, but I want them to look for what's the effort? Is he all in? Is he 14 weeks I'm done? Because that's not what we want at all, right? We want them to embrace the idea that it's taken me 50 years to get to this point. I'm not going to change this in 14 weeks, but I do need to implement change. And so in core, I'm challenging these guys, you're not just learning something here. Tell me what you're applying as we go through core. What are you doing day in and day out now to change? What fundamentally are you doing to express empathy, for instance? What does that look like? What does she need?
Love it.
Right?
So this is a nice segue, Dr. Hudson, into the topic of, so we're talking about chauvinism. We're talking how that overlaps at times with narcissism. We're talking about how that overlaps at times with misogyny. Right. Now we've added another layer. We're talking that in all likelihood, these are character traits, character issues. And so at first glance, and Dr. Hudson, you've heard this as much as I've heard it, we have people out there, actually, frankly, most people out there in YouTube land would say that there really isn't much hope here. And you know where I'm going here, because my group is filled with men who actually have chosen to come to Advanced Core. And now Core Strength, which is a 6-month program after Core, after Advanced Core, my group is filled there with men who want to be there. But so the topic of what can these men change? Right. Is there really any hope? And are we just kind of, I don't know, please speak to this.
Thank you, Dr. Hawkins. And you make an excellent point about how the continued work is so important, right? It really proves out who is really committed to the work. You know, you can tell the guys, even during core, who are, yep, I did my homework. What else? I mean, is there something else I'm supposed to do? Yeah, you're supposed to apply it, right? And so we start with that, and that is a building block for permanent or long-term change. Excuse me. So maybe they implement something in core that's out of discipline because I've said you must do this, you need to do this, and so they're convinced, or their peers in that group, hold them accountable. They're not mentoring each other, but they hold each other accountable, which is really nice to see. But some guys just don't get it. But the guys who do, yes, they can change and they will change because they determined and they understood the need for change. And it's not just about, because it's not just about their marriage. It's not just about their spouse, because I have seen guys, and you have them in advanced core right now, who their wife has filed for divorce and she's gone.
Right.
She's had enough. She can't handle anymore. That's not disparaging her that at all. Right. She made the decision that she needed to make for her. My point is that those guys who stay in and keep working and keep attempting to change, keep working on change, will and can be successful.
Well, that's a mouthful, Dr. Hudson, because every woman that is watching our videos and is reading about our programs, she's also watching videos that say, no, not going to happen. And her experience has been, it's not going to happen. Mm-hmm. So when we come along and say, oh, it can happen, I want to emphasize two words that I'd like you to talk about. So we don't just sit back and say, oh, come on, you just got to believe. You just got to believe. You got to trust that he can change. Well, I never say that. Mm-hmm. In fact, I would say, I would like you to be distrusting. Right. Frankly, I would like you to, I don't want you to trust anything at this point. But to two words that I'd like you to speak on, these two words, intervention and treatment.
Right.
So I'm going to presume that you believe the way I do, that if you do what you've always done, you're going to get what you've always got.
Correct.
That's a popular notion. Right. And if you do what you've always done, but magically believe that somehow next month is going to be different, that's called insanity.
That is.
But if we can bring an intervention to bear, which is a whole nother podcast, by the way, we need to do that. So put that on your tickler. We need to do, but please speak to the notion of intervention. Do you agree with me that intervention must happen?
Yes.
And then treatment. I mean, we're not just, please speak to those two words, if you will.
Well, absolutely. And intervention is where it starts. I mean, if we, during the marriage evaluation or the initial contact we have with these men is if he's solid in where he is and who he is and who he's going to remain, we really can't continue with them. It's the same as understanding the concept of alcoholism. What's the first step, right? In treating alcoholism successfully, they first have to admit what? That there's a problem, right?
Yeah.
And if in our initial exchanges with a couple, with an individual, with a man, he says, there's no problem here, right? What work can be done? It's that is the critical piece to understanding, the difference between, positive outcomes and negative outcomes, right? So if he says, though something's wrong here, I know we need to address this. I might have a part in it. That is the edge. That's the slip in the door where we can begin to have a conversation. Well, and oftentimes you have the same experience I do, Dr. Hawkins, you guys are our last hope. We've been to,
absolutely, hear that all the time.
We've been to 4 or 5 different counselors and therapists. And this is not saying they're not good counselors and good therapists. They just don't understand maybe this area called narcissism or emotional abuse as well as others do, right? So our treatment model is different in that it's based in intervention. You have to understand that there's a problem and you have to own the problem, right? So that's critical.
I want to make sure people hear this, Dr. Hudson, that you used a phrase, it's a crack in the door or whatever. I forget the phrase you used, but it's it doesn't, a man doesn't come to our treatment program and within 2 weeks become a a stellar example of someone who takes ownership for all of their problems, all of their character issues. It doesn't happen like that. We're looking at incremental change, but we need a crack in the door.
Right.
We need some kind of awareness that, okay, there's something wrong. I'm not sure I'm really the person that's wrong, but I'm open to at least talking about this. So anyway, would you agree that the intervention, it can be an incremental and then incremental, then incremental, and it's successive little victories, and then over time, this intervention and treatment. Talk about treatment and incremental changes.
Absolutely. So, and I appreciate you asking that question, Dr. Hawkins, because intervention that's successful is incremental. It's you're not going to, and you said we don't ever have the guy in 2 weeks who says, yeah, I'm it. I'm the problem. I think sometimes, rarely, but we do have one or two that I've seen recently, but I don't know if that's because of where they are in life, and they've been entertained by this idea from their wife for in a more open forum, more receptive to it. But that is absolutely rare that we have the guy. So, and our model is,
but it happens.
Yeah, it happens, but it's very rare. I agree with you. But intervention through our treatment is continual. So we're not doing the same thing in week 4 or week 6 or week 8 or week 10 of core that we were doing in week 1. We're building on that. The guy in group who doesn't embrace that is the problem that we have to address outside of core. So we will actually encourage that guy. Hey, let's schedule some time outside of core. I think there's a couple things we need to talk about. Right? Because even though it's a group, we have a very small group on purpose so we can develop individually tailored interventions for that guy's situation. I'm a believer, and I believe you see, I would presume you have the same mentality, that there's no cookie cutter way to address each unique situation. But there is a model that we can use to facilitate that intervention. Does that make sense?
It makes a lot of sense. And as is typical of me in doing podcasts, Dr. Hudson, I want to have you back, and I want to talk more about treatment. But we've got to bring our time to a close for today. This has been absolutely wonderful. And you've helped us to understand chauvinism and narcissism and misogyny and characterological issues. You are the head of our core men's program, and I really cannot recommend you more highly. You, if anybody is experiencing emotional abuse, you're not even sure if you're experiencing emotional abuse, you're wondering what this is, Dr. Hudson, you are our preeminent specialist in heading up our core men's group and our advanced core groups. And so I want to just recommend you highly. Is there anything else you want to say just to let people know I'm here, I'm ready to answer questions, I'm ready to do evaluations. I'll help you gain clarity as to what's going on in your life.
Well, thank you, Dr. Hawkins, for inviting me to the show today. It's been a pleasure to talk with you as always. And I would encourage people, pick up the phone. If you're not sure exactly what's going on in your relationship, husband or wife, pick up the phone and give us a call, and let's set up a free consultation just to sit with you for a few minutes and talk about your situation and see what we can do to help. You know, we're not the answer for everyone, but we can be the answer for you.
I couldn't say it better. Thank you so much, Dr. Hudson. Thank you for being our guest today.
Thank you very much.
I hope that today's podcast has been enlightening and encouraging to you. It certainly is a topic that needs to be talked about, and we encourage you to subscribe to our channel. We have many more podcasts coming your way, so please click that subscribe button.